This is the echo machine. Echo is one of the machines we use in assessing the heart. It makes us see the heart properly to see if the heart is functioning well or if the structure of the heart is okay. And the heart is very important for all humans to it's one of this. In fact, is the powerhouse of the cardiovascular system, and it is vital. The heart assists in daily activities. It is vital for our movement and also to carry out normal activity. So the priority for us in cardiology is to make sure that the heart is able to carry someone very well to old age. And also, if the heart is impaired, it affects other organs that are important.
That's what I tell people.
Yes.
I tell people that the heart is the center of life. And, you know, if I would choose any profession, anytime, anywhere, I would choose the heart. Because you can't say you are alive if your heart is dead, you know. Other people may argue anyway, but exactly. as a fellow cardiologist, yes, I agree with you. Yes.
So the heart, like, now, if the heart is impaired or has dysfunction, you know that it will affect important organs like the brain, and we know what the brain is for. The brain is for us to think well, function well, make proper decisions. Now, also the kidneys helps in clearing off debts and also make one to function well. Now, if the heart is impaired, it also affects the kidneys.
Yeah.
Yes, and also the eyes also is important.
Every part of the body depends on the heart.
Yes.
Okay, so in terms of care of patients at the Rivers State University Teaching Hospital, where you work, how are the cardiologists able to cope? Are their patients large, or do they just have a few persons coming with heart diseases?
In terms of, like, in BMH where I work, like Rivers State University Teaching Hospital where I work, the low volume of outpatient is very large.
Yes.
We had to form 2 separate units of cardiology
to be able to manage them. Yeah.
And each cardiology clinic will work most, like the last cardiology clinic we ran, we had to leave here by past 4, and the normal time is 8 to 4 p.m. just to let us know how busy
the clinic is. Yeah. So we have, and what are the commonest cases you see here?
Now, the commonest case in our cardiology clinic is hypertensive heart disease, like damage to the heart from hypertension. That's the commonest. Followed by what we call ischemic heart disease, whereby there is a kink in the blood supply that supplies the heart.
Yeah. What about valvular heart diseases?
We see valvular heart diseases when you compare it to, I would say that's the 3rd common cause of heart diseases in the hospital. However, the valvular heart disease, we also observe a pattern. Either we see it more in young person and elderly people.
Yes.
So those are
the elderly ones are usually from,
like 60 and above.
Yes, senile valvulopathy. Okay. Now, I'm worried about congenital heart diseases. Have you seen any in our environment?
Yes, we see congenital heart
disease. What are congenital heart diseases in the first place?
Congenital heart disease are like heart disease that occur during development of the heart when the person is in the womb.
Yeah.
So it's something that occurs, like the person is born with congenital heart disease, that is abnormality, mainly the structure of the heart. Abnormal structure.
Well, I would think that they would die early if they are. But do you still see them in adult clinic?
Yes, because we are lucky to have pediatrics cardiologists that usually take care of them when they are small. Okay. And we have pediatrics cardiology in our hospital. Yeah. So they take care of them when they are small. So when they are up to adulthood, they come to us and we continue the management. And they don't die commonly, unlike popular belief that once you have a problem, you die.
Okay. Some of them stay longer.
Yes, even stay to old age.
I remember we saw one young man with a very abnormal heart. Young, so to speak, but small for age.
Yeah. Yes.
All right, that's interesting. So, in terms of echo, how much is the cost of an echocardiogram?
Okay, echocardiogram, the cost is 30,500. Yes.
37.
No, it's 35,000 now. We just increased it because of logistics and increase in equipment we use.
People are going to wonder that is too expensive, can you advise them to still save up money, seeing or at least trying to argue for the benefits they will get from
Now,
it?
the echo is truly expensive due to the current economy. However, without the echo test, there are many things like the doctor will not be able to see, and the
So
echo
the
test help us.
cardiologists will be
Yes,
blind, so to
yes,
speak, in caring for
yes,
their
exactly. That's
patient.
the right word. Cardiologists will be blind, so you might not give beneficial drugs
Yes,
for the patient.
so
Yes,
so you're encouraging them to try as much as
possible.
possible to get an echo
And
done.
the echo we do here is, if you compare the price to other places,
Well,
it's,
cheaper.
yeah, it's quite cheap.
Apart from being cheaper, what else is the benefit of our echoes here?
Now our echoes are is because when we do echo, we have consultants that verify the echoes. Now we have a teamwork of consultants that go through our echoes
So
here.
peer reviewed
Yes,
echo.
peer reviewed. That you will only get in teaching hospital, unlike other places where they just
So
one
you
person
encourage
does the echo.
people to come because you know the quality of the echocardiograms we're getting at the River State University Teaching Hospital. What are other investigations?
Now we have other investigations, like we call it electrocardiogram.
Okay.
Now that's we is almost like echo but not echo. We also have stress ECG. We also have Holter a monitor. We also have other ends like blood tests that we can do, cardiac markers, and liver function tests, kidney function tests. Those will help in evaluating the cardiac patient very well.
Okay, that's nice. Some people don't know, how much we can do at the River State University Teaching Hospital. It's obvious that we can do a whole lot, and this is also helping us in research. Yeah, I just wanted you to capture a picture of an echocardiogram.
Okay.
Just a picture. I hope the names are not there. If you can get us without the name, just to see.
Okay. I have to cover the name, so
Yes,
for privacy
for
sake.
privacy, yeah. Okay, so this looks like if you tell somebody what is this thing now, they won't even understand what you're showing them. All right.
Yes.
Can we see some more pictures? Okay, these are the measurements. Cool. Now this looks like graphs, but they're actually representing chambers of the heart. This is a heart structure. You don't have a moving frame.
Except I look at other saved images.
Okay, not a problem.
Mm.
You will send me those ones later.
Okay.
Thank you very much, Dr. Dema Asikimabo, for it. Thank you for taking care of our hearts. It's World Heart Day on the 29th. Say an advice. Any advice you have to give to our River State indigenes or River State populace, inhabitants of River State?
Okay, yes, the advice I will give to everybody, because the heart is important, I will advise every adult, even young persons, to at least once in a year, even if you don't have heart condition, once in a year, come to the hospital and check your heart to see if there are hidden things you're not.
Okay. Thank you very much. Thank you. You didn't tell them Happy World Heart Day.
Happy World Heart Day.
Thanks.